Obamacare still has a lot of problems, obviously, ladies and gentlemen, ranging from, in some exchanges, there being a strong sort of diminishment of competition. You have not only some insurances costing way too much, but high deductibles. With all that said, more than 7 million previously uninsured Americans gained health care coverage in 2015. And so as of the fourth quarter of last year, just 9.1% of U.S. residents had no health coverage. That's a decline of 2.4 percentage points and 7.4 million from the year before that. Consider that 19 states continue to refuse the expansion of Medicaid. You're talking, I don't know how many people. That's probably like somewhere around 7 million people would be my guess. So there's been there's been a significant increase in the number of people insured. And there is a theory that you get everybody insured, and from that standpoint, then you can really start to change the way the delivery happens. I mean, we have Hillary Clinton now on the campaign trail. It's not like she hadn't supported it in the past, but it's the first time during the context of the presidential campaign, first time I've heard her basically talk about it in 8 years, if not more, is the Medicare buy-in. And that's basically it, right? I mean, the way that we will get to closer to a single payer health insurance. And, the problem we have now with and John from San Antonio has been ringing this bell for years, particularly in the lead up to, I think, the attempt by Vermont to have single payer, which basically was aborted early in the process, is that when you ask people if they want single payer health insurance, it polls, I think, in the 70s. When you start to give them the details, it becomes a much harder sell because the sell is like what we heard during the course of this campaign. It's going to cost trillions of dollars. You never hear the other side of it, which is, oh, and also it's going to save you trillions of dollars. I mean, it is true that everyone's taxes will go up if we have a single payer system. I don't know the exact algorithm, and I think that's a function of what the policy ends up being. But the reality is, for every dollar more you pay in taxes, you will probably save $2 in healthcare, maybe more, depending on how much healthcare you need. But over the course of a lifetime, it's significant. And if the idea is that everyone if you get to universality, then you begin to Medicare buy-in at age 55, then a Medicare buy-in at age 45, and so on and so on and so on. And then it just becomes, what is a Medicare buy-in but just sort of a targeted tax or and then that tax burden, as it expands, then everybody's participating in that tax burden. So, I mean, that's the way that's going to go. But it's going to be, you're going to see Hillary Clinton talk about this if she is the nominee. I mean, obviously you'd see it with Bernie as well. But she has been running a campaign where she is arguing for a third Obama term in some respects. And another important figure just to keep an eye on, 11% 11% is the number of Latinos. Is the percentage of the decrease in uninsured amongst the Latino community in this country. Just some interesting figures that came out that I thought I would share. Hello, you. I'm Sam Seder. Looking for smart progressive talk that is occasionally amusing? Well, subscribe to our YouTube feed. Subscribe to our podcast. Like us on Facebook. And just generally enjoy us.